health and a little wealth and a lot of love.
So tell us about the pitfalls of, traditional medicine with this new wave of functional medicine, and how this you touched on it earlier, but anything else you want just the people to know? What are the pitfalls with everyday medicine, and how can people really react to what you're saying, with exiting doc behind the curtain view?
Yeah. I mean, in medical school and residency, we learned that there needs to be a shift away from kind of what we call the paternalistic, model for medicine. The doctors just told you what you were supposed to do and you just followed it, and you took their recommendations, you didn't ask questions. And now it's supposed to be more a shared partnership. You're supposed to be able to educate your patients and decide, yes, you can educate them on how to improve their health and avoid chronic diseases, but it also, what are their drives? What are their motivations? And what are their deficits? What do they need to learn? And it's more of an individualized approach. And unfortunately, with the shortages of not only doctors, but nurses and other healthcare providers, it feels like it's turning into an assembly line. We just don't have the time in the traditional primary care model to really sit down and talk to patients and educate them. And it's just trying to put out fires. It's like playing a game of whack-a-mole. That's really what I feel like my day-to-day felt like, because you'd have, especially after the COVID pandemic, you'd have patients that came in that hadn't been seen by anyone in 3 years, and they schedule an annual physical, but they really want to talk about 5 different health problems at the same time, and you can't talk about all of those things without then pushing the rest of your schedule back 30 plus minutes, and then everybody else is pissed off at you because you're running late for their appointment. And I just don't see it getting better unless there are some significant changes.
Yeah, absolutely. I know a lot in my Facebook feed, I see a lot of people complain in the waiting room. I'm waiting forever, I'm waiting forever, I'm waiting forever. And the number one catalyst that I've seen is like the doctors. I don't think that's fair. You have to see patients every 15 minutes. Sometimes they come in for an annual physical, and then they want to talk about a health problem. Like, how does that work with insurance and billing and all of that?
That's the other thing. It's hard to navigate that when you get out of training as well, because you don't really learn a lot about the billing and coding.
But why
side
would
of
you need to
things.
know the billing? I'm sorry, I'm interrupt, but why would you need to know the billing and coding?
Well, now physicians have to do their own billing and coding.
What?
So
Wait a minute. So you have to do your own billing and coding now?
Mm-hmm.
Well, my mom she worked in healthcare for 25, 35 years. And so I know a lot about this just because being raised around it. That is not easy.
With a little health and a little wealth and a lot of love. That's the life that we live. Suits and scrubs.